Steve, very good question. It was one of the best questions I've ever heard before. And Scott, very good response. Very good. Just want to give you guys both shots out for that.
Thank you. Carla, a lot of us here take it very seriously when one of the speakers says, I'm going to tell you the most important mineral. I'm going to tell you why you need magnesium. I'm going to tell you why you need a probiotic. We write our notes down. We call up to find out how to get the probiotic. Because we think that the supplements and the food and the exercise is everything. However, every now and then someone says, by the way, emotional health is a real thing. And anger and resentment and judgment actually puts chemicals in your body that are bad, just like fried food. Now, a lot of us think that's fluff. And we go back to focusing on what supplement do we take? What food should we take? Can we have, a smoothie? We're very focused on the food. But we're walking around angry and judgmental half the time and blaming and people mad at Trump and mad at Biden. So from a real scientific perspective, is this a cause of disease that we're judging and angry and resentful and blaming? Is this something that we should care about as much or more than our food or exercise and our diet? Or is that just something that sounds good to say?
Well, we know from the research that these 10 healing factors made a difference. These were common among all 1,500 plus of the survivors. And again, they overcame a late stage diagnosis. And we don't know yet which, if any of these, is more important than the other. But we know that of the 10 factors, only 3 of them are physical and the other 7 are emotional and spiritual. We also know from independent studies that are done on stress management, et cetera, how impactful it can be. So there are studies that show how stress affects our immune system and cancer recurrence and long-term survival. And so we can look at those studies, and there's many of them that can help us understand what this does to our bodies. And you're right, it's releasing hormones, releasing stress hormones into our system that's depleting or dampening our immune systems. And when we want to overcome a diagnosis, we need our immune systems to be at tip-top shape, optimum, functioning. And so many of the emotional and even the spiritual things are helping us to rebuild our immune system. In fact, all 10 of the healing factors that Dr. Turner uncovered in her research have separate studies to show why that particular thing increases the immune system. It improves the immune system to help us then get back to a point where our bodies can overcome what's happening to it and can get back to producing the good hormones and dampening or really getting rid of those cancer cells or diseased cells that shouldn't be there. Does that answer your question, Steve?
Yes, thank you.
Of course.
Cyrus, Dr. Stoll, do you want to answer that same question? Do you have any thoughts on it?
Cyrus?
So I haven't actually read the research myself. I think a lot of the times people want to see a randomized control trial, right? That basically says, okay, we can take a look at this population and we can say, these are the things that this population has in common. And these are the factors that led to an improvement, right? That's like observational research, which is very powerful. But then if you really want to put something to the test using the scientific method, you do what's called a randomized control trial, where you say, we're going to take a group of people, we're going to split them into 2 different groups. We're going to do, intervention A here, intervention B here, and then we're going to test the difference between the 2 of those, right? So I haven't personally read the research specifically about how to, a randomized control trial on emotional health when it comes to overcoming metabolic disease or cancer. However, I have talked to many natural health professionals who all have done the research themselves, and they have all come to the same conclusion. So I'm going to defer to them, and I really can't really speak about it with any air of authority until I actually do the research myself.
Thank you.
Yeah, and I would just simply add that there's a growing body of research to show that when we're experiencing stress, and stress can be any of those emotions that you mentioned, post-traumatic stress, anger, unforgiveness, bitterness, the body interprets that through the lens of the stress response. which releases noradrenaline and cortisol, which begins disrupting the microbiome and producing inflammation. And so there is, a growing body of research that shows the levels of oxidative stress and inflammation associated with emotional disruption and strong linkages to heart disease, cancer, autoimmune diseases, and a host of other diseases through that stress mechanism.
Thank you. Carla, what do you say to critics who argue that holistic cancer treatments can dangerously delay conventional treatments?
Well, I think from the research, we see that there is something to learn from those people that take an alternative approach. In that first book that Dr. Turner wrote, it was based on people who had either done an alternative approach or had done the conventional approach, which failed them, sent them home on hospice, and then they did their own thing and overcame. So there's something to learn from those people. And I think there is a time and a place for people to act quickly and to utilize conventional medicine. And many diseases, you've got time to think about it and maybe try some other ways before you go to the extreme of chemotherapy and radiation. I'm not against chemotherapy and radiation. My first cancer diagnosis, I went through it myself. With my metastatic diagnosis, I did not need to go through that again, but I believe that there is a place for people to try to heal themselves, to really get themselves on that whole food plant-based diet and get the right exercise and clean up the emotional garbage that might be hanging around in their body and really take care of some other things. Most cancers take some time to grow. So if it's not an aggressive, fast-growing cancer, you probably have some time to be your own little experiment. 3 to 6 months, give it a try. See if you can start to reverse things or get a better result, get things stable, and then make your decision.
Thank you. Cyrus, how do you address critics who argue that a high carbohydrate diet might be maybe detrimental to individuals with diabetes? So even if you're eating a whole food plant-based diet, if you're having lots of beans, lots of sweet potatoes and potatoes, lots of whole grains, doesn't this raise your blood sugar?
Okay, so I'd say it's a very good question. And truth be told, that is the one argument that has persisted since, as far as since the time I was born through now, and I think it may never go away. There's a lot of conflict in the world of diabetes about carbohydrate, right? People refer to them as carbs, and people say carbs are bad for you because carbs contain sugar, and carbs contain sugar. Therefore, they're going to raise your blood sugar, and sugar is bad for you, and sugar is going to make you fat, and it's going to cause your blood sugar to go up. And as a result of that, you're going to end up with diabetes. But if you go backwards and take a look at the actual biology and you draw out the biochemical pathways on a piece of paper to understand what happens to carbohydrates when you consume them from whole food sources containing a significant amount of fiber, as Dr. Stoll had mentioned earlier, what you'll find is that there is a giant difference between people who eat refined carbohydrates that are low in fiber and people who eat whole carbohydrates that are high in fiber. Okay, so if you literally just took all of carbohydrate biology and you split it down the middle and you said, these are the refined products that come from manufacturing processes, and these are the whole products that come from fruits and vegetables and legumes and whole grains, right there, that would take care of 90% of the conflict, because the whole carbohydrates on the right side are the ones that are actually associated with and actually causational in improving health outcomes, whether that's reduced risk for diabetes or heart disease or for certain forms of cancer. Okay. The refined carbohydrates are the ones that can be metabolized very quickly because they come with a very small amount of fiber. They can cause detriment to your liver. They can cause detriment to your insulin signaling pathways inside of your liver and inside of your muscle. And they can cause high blood glucose, high A1C, and metabolic distress. Okay. So we must make that differentiation when we're talking about carbohydrates, period, end of story. So anytime that somebody says, I'm eating a low carb diet, I immediately challenge them and I say, What type of carbohydrate are you talking about? You cannot talk about the word carb unto itself. It has to have a modifier in front of it. It's either whole carbohydrate or refined carbohydrate. And if you can't tell me that, then you're going to get confused. Okay. The second thing that I would say is also that when you consume carbohydrate energy in a high fat environment, it will not work, because if you look at the biology on a piece of paper, what you will find is that fatty acid metabolism and glucose metabolism are two completely separate metabolic systems. It's not just one pathway, it's a collection of pathways on both sides. And the two systems do not play nice with each other. And what I mean by that is if you're eating a diet that contains a significant amount of dietary fat and or cholesterol, you literally activate many of the biochemical pathways that are responsible for digesting and transporting and uptaking and storing and oxidizing all of that energy. Similarly, if you did the opposite thing and you started eating a significant amount of carbohydrate energy, then you're going to upregulate all of the enzymes and the workhorses responsible for digestion, transport, uptake, storage, and oxidation of carbohydrates. The problem is that when you do the two of them at the same time, things can go very weird. When you do the two of them at the same time, that's called the standard American diet. That's when your fat intake is relatively high, your carbohydrate intake is relatively high, and that is a recipe for disaster that can lead to hyperglycemia, which is high glucose, hyperinsulinemia, and it can also lead to hypertriglyceridemia, weight gain, high cholesterol, high blood pressure, and beyond. So the last thing I'll say here is that we need to make the distinction between whole and refined carbohydrate, no questions asked. But secondarily, we also have to do it in a way where if you really want to be able to eat a carbohydrate-rich diet and control your blood glucose with precision, which again, we've seen thousands of times over, and there's plenty of research to demonstrate it, it has to be done in a low-fat environment, period, end of story. That's true for adults. It's true for children. It's true for humans. It's true for all mammals. And so once people recognize that carbohydrates have to be consumed in a generally low-fat environment, then all of a sudden, a lot of the confusion dissipates away and it becomes a much more understandable story.
Thank you. Dr. Stoll, I want to read you something and tell me if you have any thoughts on this. Total knee arthroplasty is the most commonly performed total joint replacement surgery in the United States, with over 600,000 procedures occurring annually. Total hip arthroplasty is the second most common. Both types of surgeries are significant in volume and are expected to increase in the coming years due to factors such as the aging population and the rising prevalence of conditions like osteoarthritis. In light of the increasing prevalence of joint replacements, what proactive measures can be taken to prevent the need for knee or hip replacements? Is this something that you feel that our diet and lifestyle can have any impact on?
Yes, absolutely. And it's similar to when we're talking about diabetes, heart disease, and other cancer and other chronic diseases. We have to say, why is there an epidemic of total knee replacements? And hip replacements. And again, we can look to our lifestyle as one of the leading causes. We know that additional body weight, every pound of body weight is 3 to 5 additional pounds on a knee or an ankle. And so as people get heavier, they're putting additional shear forces on their joints every single day. We also know that the diet and microbiome that are produced by that diet create inflammatory molecules that digest and destroy cartilage. So the food that we're eating is also contributing to the damage and destruction of our cartilage. We know that old, unhealed, and restored injuries create biomechanical imbalances in the body, just like our car tires. If our car is out of alignment, one of the edges of our tire will wear down. Same thing in the body. If we're not exercising, stretching, trying to maintain some biomechanical alignment, our body can get out of alignment. We're on phones all day, we're on computers, we're sitting, we sit in improper positions, and our bodies get out of alignment, we begin wearing down joints, preferentially in one side versus the other. Some of the traditional musculoskeletal care can damage the cartilage and accelerate degeneration. We know that NSAIDs, which are commonly used, anti-inflammatories, ibuprofen, Motrin, etc., disrupt the gut. They disrupt the microbiome. They can contribute to long-term impaired healing, especially healing of cartilage and ligaments. We know that injections of cortisone into a joint actually damage the chondrocytes that help to repair cartilage. So repeated cortisone injections accelerate the degenerative process of a joint. And just even knee arthroscopy, going in and cleaning up the knee, as the orthopedic surgeons like to say, can also create more instability in the knee. And the research shows that knee arthroscopy accelerates the time to a total knee replacement. So there's a multiple factors, which really go back to the same kind of choices of, eating the right foods, rich in plants, and many of those foods, broccoli, grapes, greens, etc., help to balance and support the chondrocytes to rebuild cartilage in the knee. Exercising in such a way that we're just maintaining movement and flexibility. Sitting Indian style, sitting with our crossed legs open, where our hips open up, stretching our thighs and our hamstrings. So we have a nice elongation of our legs, doing downward dog as a stretch to stretch the posterior chain. And trying to look for ways to take care of a problem early rather than late. When we have pain, it's our body telling us that we have a problem. We don't want to put duct tape on the pain, and so we don't take anti-inflammatories to try and cover it up. And so dealing with an issue when it's early, when it's a small problem before it gets to be a big problem, through good therapies, functional fitness, healthy alternatives to cortisone, like platelet-rich plasma, prolotherapy, to help support the body's healing process.
Thank you. Carla, how do you balance optimism with realism when discussing cancer prognosis with your clients? And also, of all the 10 lifestyle changes you suggested, which do you believe has the biggest impact on preventing a cancer recurrence?
Mm-hmm. So balance is definitely important, and I am a born optimist, and so I will always probably lean a little bit more that way. But some people are in dire situations, and it can be hard to find your optimism and to balance, people's expectations, like these 10 healing factors, changing your lifestyle. It's not a guarantee that you're going to overcome this diagnosis. I like to be really honest with people. I like to ask them really hard questions that, if they're ready for it, let's dig in a little bit deeper and figure out, what's going on in your life that might need to change. The thought is that if you're a hospitable host to cancer now, the best way to become an inhospitable host is to change the environment in which it grew. And that's the physical environment, the mental, the emotional, the spiritual environment. And, there are people who, everybody that gets a cancer diagnosis gets scared. They get the anxiety from it, right? The stress of it. And I try to remind people that if I could catch them before they talk to their doctor, I'd say, don't listen to the prognosis. Believe the diagnosis, not the prognosis. And I believe Deepak Chopra is one of the first to say that. But it's so true because nobody knows for sure what the outcome is going to be. Nobody, the most educated guess doesn't mean it's right. And so many people put so much weight on that prognosis from their doctor. I've only got 2 years left to live. I've only got 3 months to live, right? That it can become a self-fulfilling prophecy. I believe we need to have hope and faith and belief in our ability to change the environment in which cancer grew. So balancing that realism and optimism is important, and increasing our positive emotions, like I mentioned before, is a muscle that needs a workout. So it's really important that we try to bring in laughter and joy and happiness every day to balance out the anxiety and stress and fear that we're under. And really looking at, what can you do What actions can you take that are going to help you? So not just following doctor's orders, unless it's Dr. Stoll, then maybe you would just follow doctor's orders. But, most conventional doctors aren't telling you that there's anything you can do about it. So that's kind of where I've got on that one. And then the other half of your question, I'm sorry, I already forgot it, Steve.
I already marked it in red. Hold on.
You already checked it off.
What lifestyle changes do you believe, which to prevent reoccurrence, what of the 10 lifestyle changes do you feel is the most powerful?
That's really hard to say. That would just certainly be my personal opinion. And again, we don't know which of any of these factors is more important than the other. I know for myself that a plant-based lifestyle has made a huge difference to how I feel, how I look, how, just how my cancer has been in remission for 7.5 years. No evidence of disease, actually. But they're all important. I think I wouldn't want to put diet as the only thing. I think the other really important thing for me was slowing down my lifestyle, which I put in the category of deepening my spirituality, because I spend a lot more time sitting and just being, listening to the inner voice, listening to the voice of a higher power. And I think that is a huge part of my healing. And I would never want to give that up.
Thank you.
Mm-hmm.
Cyrus, everything I've been asking you is kind of geared towards people with type 2 or type 1.5 or diabetes or type 2 diabetes. For people that have type 1 diabetes or maybe type 1.5, but specifically type 1, what do you want to say that's different about the approach or the philosophy than the approach towards type 2 diabetes?
Okay, very good question. So people with type 1 diabetes, myself included, generally speaking, are either diagnosed with, it's basically an autoimmune version of diabetes, which means that the beta cells inside of your pancreas have been targeted for destruction by your own immune system. So your immune system is the one that's decreasing beta cell count. And as a result of that, your ability to secrete insulin goes from being what's considered normal to as close to zero as possible. So people who are living with type 1 diabetes end up getting to full insulin dependence, usually about 12 to 18 months after diagnosis. People who are living with type 1.5 diabetes are usually, generally speaking, over the age of 30. They have a weak autoimmune program inside of their body, which also targets beta cells for destruction, but doesn't do it as powerfully as type 1. So you can think of type 1.5 as basically being slow progressing adult onset type 1 diabetes. Okay. Regardless of whether you're in the type 1.5 or the type 1 bucket, the recommendations which I had laid out earlier are all still 100% applicable for those in both of those categories. And what Robbie and I basically did back in the day when we were first developing the Mastering Diabetes method is we thought to ourselves, you know what, there's a lot of confusion. There's a lot of, there's many different types of diabetes, and they're getting more complex over the course of time. And what are the generalities? What are the commonalities between all the different diabetes types? And what we determined, what we learned through experimentation on our own body and also by reading the research is that insulin resistance is really the uniting factor that unites all forms of diabetes. So like I said earlier, the three pillars are low-fat, plant-based, whole food diet, consistent movement, and intermittent fasting. All three of those still apply to people who are living with insulin-dependent diabetes. Intermittent fasting, again, is an approach that's not 100% applicable to all people. Okay, it generally applies to people who are overweight because it's a simple thing that they can add to their regimen that will help accelerate the rate of weight loss. If you're already at your ideal body weight, you can still perform intermittent fasting, no question. You just got to be a little bit more scientific about it to make sure that you're not going into a calorie deficit. And if you do, then you can end up becoming underweight, which can cause problems down the road with either sarcopenia or osteoporosis. And nobody wants that. So generally speaking, all of these same principles apply. What we have seen is that people who are living with type 1.5 and type 1, you can't reverse it using any of the strategies that I'm suggesting here. Okay. We're not trying to insinuate or trying to directly say that this is a diet type 1 or 1.5 reversal protocol. It is not. And I cannot make that claim, and I will never make that claim. This is just a way to improve your time in range, to decrease your glycemic variability. In other words, get a much more flatline blood glucose. And as a result of that, that unto itself can significantly reduce your risk for many chronic diseases, many ancillary chronic diseases into the future. Many cardiovascular abnormalities can significantly get reduced. And then all of these sort of like inevitable consequences of living with diabetes, like peripheral neuropathy and retinopathy and erectile dysfunction, they tend to fade away into the background as well. So we like to think of glycemic control as one of the more powerful levers that you have at your disposal, regardless of the type of diabetes you're living with, that can help not only improve your diabetes health, but also get you to a point where your risk for overall chronic disease is significantly lowered.